Hey everyone, Dr. Hannah McLeod here. Now, I've been practicing medicine for over 30 years, and I've got to tell you something that might surprise you. After 3 decades of consultations, I still have patients come into my office, grown men, fathers, grandfathers, who don't really understand how their partner's body works. And honestly, that's completely okay. That's why I'm here. Today, we're going to talk about something that might make some of you a bit uncomfortable at first. But stick with me, eh? We're diving into the anatomy of the vulva and vagina. Now, I know what you're thinking. Dr. McLeod, why do I need to know this? Well, whether you're supporting your partner through menopause, trying to understand what she's experiencing, or simply wanting to be a better, more informed companion after all these years together, this knowledge matters. Trust me on this one. I'm going to share 8 facts with you today that I've learned over my 30 plus years working with patients across Canada, from Vancouver to Halifax. And here's the fun part. Let's make this interactive. As we go through these 8 points, I want you to keep track in your head. How many of these did you actually know? At the end, leave me a comment telling me your score. Did you get 4 out of 8? 6 out of 8? All 8? Let's see how you do. Before we jump in, I want to mention something quickly. If you or your partner are dealing with intimate health concerns, whether that's erectile issues, concerns about hormone levels, or just questions you've been too embarrassed to ask your family doctor, please know that these days we can consult with you remotely. Phone consultations, video calls, whatever makes you comfortable. After 30 years, I've heard it all, and there's absolutely nothing to be embarrassed about. Health is health, right? All right, let's get into it. Number 1, and this one surprises almost everyone, the vagina actually changes shape, and it looks a bit like a Diabolo when it does. You know what a Diabolo is, right? That juggling toy that's narrow in the middle and wider at the ends. Stay with me here because this is fascinating stuff. In its neutral resting state, the vagina has one shape, but when arousal happens, something remarkable occurs. Just like a penis changes during arousal, and I know you fellas are familiar with that. The vagina goes through its own transformation. It's preparing itself, getting ready for penetration, if you will. Here's what happens. The inner part of the vagina increases in volume and swells up, while the outer part, right at the opening, stays slightly more condensed. This creates that Diabolo shape I mentioned. The body is absolutely incredible when you think about it, eh? This transformation shows just how adaptable and responsive the human body is to arousal and intimacy. Now, I want you to pause for a second. Did you know this? Keep that in your mental tally. Number 2, and this is something I wish more people understood. No 2 women have exactly the same shape of labia. The uniqueness of the labia is so pronounced that it can actually be compared to fingerprints. I'm serious about this. In my 3 decades of practice, I've never seen 2 identical sets. Never. The variety of shapes and appearances of the labia emphasizes the individuality of every woman and shows that every woman has a unique body. This is completely normal, completely healthy. And honestly, it's beautiful when you think about the diversity of human anatomy. If your partner has ever expressed insecurity about this area, now you know. There's no normal or standard shape. Every woman is different, and that's exactly how it should be. This is something I think more men need to understand, especially as you support your partners through different life stages. Did you know that one? Add it to your count. Number 3. Here's where things get even more interesting. When arousal occurs, the labia actually become erect along with the clitoris. Yes, you heard that right. Erect. We often think of erection as something that only happens with a penis, but that's not accurate at all. The clitoris swells significantly during arousal, and the labia change their color and volume as well. They become darker as blood flows to them, they swell, and they change color. They also become looser in a sense. What I mean by that is they fill with blood and become more engorged, and this helps open things up, preparing the body for penetration. This is all part of the body's natural response system. Pretty incredible, right? The human body is remarkably well designed when you really look at how everything works together. After 30 years of explaining this to patients, I still find it absolutely fascinating. Number 4, and this is where the anatomy gets really interesting. The mucous membrane that lines the vagina isn't equally smooth everywhere. There are certain areas that look wrinkled, particularly near the entrance, but the deeper regions, those are much smoother. Now, this isn't some design flaw or something to be concerned about. This fascinating characteristic actually has a purpose. It functions like an accordion. Think about that for a moment. The vagina can stretch when a person becomes aroused or during penetration. The folded skin expands to accommodate the change. When there's no penetration or stimulation happening, the folded skin naturally returns to its original state. The remarkable elasticity of the vagina allows it to mimic that accordion effect, adjusting its size as needed. This provides both comfort and functionality during intimate moments. After all these years of practicing medicine, the engineering of the human body still amazes me. Here's something else about those accordion-like folds. The areas of the vagina that have these folds have a velvet-like texture. This region is extremely sensitive and enhances sensation during stimulation. The smoother skin in the deeper part is generally much less sensitive. This difference in sensitivity explains why stimulation of the first third of the vagina often produces stronger sensations than the deeper mucous membrane. The interplay of different textures and sensitivities in these areas plays a crucial role in enhancing intimacy. As men, especially as we get older and maybe our own bodies are changing, understanding this can really help us be better partners. It's not about going deeper, folks. It's about understanding where sensitivity actually is. How are you doing on your count so far? 4 down, 4 to go. Number 5, you've probably heard this before, but let me explain what it actually means. Vaginas are self-cleaning. Now I can see some of you nodding, thinking, yeah, I've heard this. But hold on, because I don't think most people truly understand what this means. When we say self-cleaning, we don't mean that the vagina sparkles or smells like roses. It's not like you've just cleaned your windows or floors and everything looks great and smells fresh. That's not what we're talking about here at all. In a microbiological sense, self-cleaning means that microbes are automatically managed and balanced. The vagina maintains its own healthy ecosystem. What does this mean for you? Well, if your partner mentions a mild odor, that doesn't mean the system is broken and needs to be cleaned. Not at all. Everything is in order as long as her discharge is consistent from day to day, same consistency, same smell. Here's what I tell my patients, and this is important. We don't clean secretions. If there are concerns, we consult with a healthcare provider and determine whether treatment is needed, such as restoring the balance of microbial flora or treating conditions like bacterial vaginosis. But the idea of cleaning the inside of the vagina, that's actually harmful and unnecessary. I've had so many couples come into my office over the years worried about this, and honestly, a lot of the anxiety comes from not understanding how the body works. So let me be clear. A healthy vagina has a smell. That's normal. That's natural. It's when there's a sudden change that we need to pay attention. Now, here's something that's particularly relevant for you gentlemen listening. And this ties into why I wanted to make this video specifically with older men in mind. As women age, particularly after menopause, the vagina can shrink, lose volume, and become less elastic. It can also become more sensitive or more fragile. Women who suffer from this condition find it very uncomfortable, and it can really impact intimacy in a relationship. Here's the good news, though. Local hormone treatments, such as estrogen or DHEA, can be applied directly in the vagina. This helps prevent aging of the vulva and vagina, and also reduces the frequency of urinary tract infections and cystitis. Now, I know some of you might be worried about cancer risks with hormone therapy. I hear this concern in my office constantly. But all current studies have shown that with local treatment, the cancer risk is very low, if not non-existent, especially in women without a personal or family history of cancer. The indications for local estrogen treatment after menopause have actually expanded over the years as we've learned more. If you or your partner are concerned about this, talk to her gynecologist or family doctor. There are options available that can make a real difference in quality of life. I've seen it transform relationships honestly. After 30 years, I can tell you that maintaining intimacy and comfort is absolutely possible at any age. Number 6, let's talk about anatomy in a bit more detail because understanding this can really help you be a better partner. The internal part of the clitoris crosses through the upper part of the vagina, not the lower part. Now, what exactly do I mean by the upper part? Imagine your partner is lying on her back. The fingers should be inserted upward, not downward. Stimulation upward is more effective for reaching the clitoris, while stimulation downward is intended for the vaginal area on the backside, near the anus. These anatomical facts are important to know, folks. The internal part of the clitoris extends outward and to the sides from the upper vaginal section. Understanding that these sensitive areas need stimulation can really improve intimate experiences. I know this might seem like technical information, but trust me, after 30 years of counseling couples, I can tell you that this knowledge makes a real difference. So many men I've worked with over the years have told me, Dr. McLeod, I wish I'd known this 40 years ago. Well, it's never too late to learn, right? Whether you're in your 60s, 70s, or beyond, this understanding can help you connect with your partner in ways that maybe you haven't in years. Number 7. Here's a truly remarkable fact. The clitoris contains between 6,000 and 8,000 nerve endings. Let that sink in for a moment. 6 to 8,000. To put that in perspective, the glans of the penis contains only 1,000 to 2,000 nerve endings. So the clitoris has about 4 times as many nerve endings as the most sensitive part of the male anatomy. That's an impressive number when you think about it. These numerous nerve endings make the clitoris extremely sensitive. These nerve endings function as sensors that perceive various sensations such as warmth, temperature, and pleasure. This heightened sensitivity makes sense because the primary purpose of the clitoris is to promote sexual pleasure. It has no other biological function. It exists purely for pleasure. Now, I'm telling you this not to make you feel inadequate or anything like that. I'm sharing this because understanding just how sensitive this area is can help you be more thoughtful and gentle. After 30 years of practice, I can't tell you how many women have come to my office saying their partners are too rough, not understanding that this area requires a lighter touch than they might think. So there you go. Now you know why. Number 8. And this is the last one, so get ready to tally up your final score. It's important to understand that as women age, particularly after menopause, significant changes occur. I touched on this earlier with number 5, but I want to expand on it because this is something that affects so many couples in your age group. After menopause, estrogen levels drop significantly. This isn't just about hot flashes and mood changes, though those are real too. This hormonal change affects the vaginal tissue directly. The tissue can become thinner, drier, and less elastic. This is called vaginal atrophy, and it's incredibly common. In fact, up to 50% of postmenopausal women experience it. Here's what this means practically. Intercourse can become uncomfortable or even painful. The vagina may be more prone to tearing. Urinary tract infections become more common. And honestly, this can be really distressing for couples who've been together for decades and suddenly find that intimacy isn't what it used to be. But here's why I'm telling you all this. There are solutions. Modern hormone treatments that are applied locally are safe and effective for most women. We're talking about creams, tablets, or rings that deliver estrogen directly to the vaginal tissue. The amount of hormone absorbed into the bloodstream is minimal, which means the risks are very low. I've had couples in their 70s come back to me after starting treatment and tell me it's like they got part of their relationship back. After 30 years of practice, those are the moments that remind me why I do what I do. Additionally, there are non-hormonal options for women who can't or don't want to use estrogen. Moisturizers, lubricants, and even certain laser treatments have shown promise. The key is talking about it. Don't just accept that intimacy is over or has to be uncomfortable. Talk to healthcare providers. Talk to each other. All right, everyone. That's all 8 facts. Now, how did you do? Did you know 1 or 2, 4 or 5? All 8? I want you to take a moment right now and leave me a comment below telling me your score. No judgment here. This is all about learning and improving, right? If you got all 8, congratulations. You've obviously been paying attention over the years, or maybe you've done some reading. You deserve recognition from everyone in our community here. But if you got 0 or 1, that's okay too. That's exactly why I made this video. We're never too old to learn something new, especially when it comes to understanding and supporting our partners. I really appreciate you sticking with me through all of this. I know it might have been a bit uncomfortable at times, or maybe you learned things you didn't expect to learn today. But that's good, right? After 30 years of practicing medicine across Canada, from treating patients in Toronto to folks in rural Saskatchewan, I've learned that knowledge is power. And when it comes to intimate health, knowledge can transform relationships. If you found this helpful, do me a favor. Hit that subscribe button and give this video a like. Share it with friends who might benefit from this information. We're going to keep making videos about health topics that matter, especially as we age. Because let's face it, our healthcare system doesn't always give us the time we need to ask these questions in a regular appointment, eh? And please, if you have questions about sexual health, intimate concerns, or anything related to what we talked about today, don't hesitate to reach out. You can book a consultation. We do phone and video appointments if that's more comfortable for you. After 30 years, I promise you, I've heard everything. There's absolutely nothing to be embarrassed about. Take care of yourselves, take care of your partners, and remember, it's never too late to learn something new about the human body. Thanks for watching, everyone.